Hello guys, today's our topic is anti-tuberculosis agents. In this topic we are gonna talk about mechanism, drugs, first line of drugs, second line of drugs, and classifications. So first, what is tuberculosis? These are those drugs which are basically used for treatment of tuberculosis. Tuberculosis is caused by the Mycobacterium tuberculosis, which is a transition between fungi and bacteria. It has tuberculosis are two types: latent and active. Latent means in which the bacteria is present in body but in dormant state, means not active state, not multiplying, but in active state the dormant bacteria, mycobacterium, is converted into active and starts multiplying and causing the infection, and it may spread to other organs also. It is an infectious disease caused by mycobacterium tuberculosis. This bacteria usually affect lungs, mainly lungs होता है because they are aerobic. Mycobacterium tuberculosis are aerobic, so they need oxygen, so they mainly are occur in oxygen needs. And second, non-motile and gram positive bacteria. So for staining we need nail Zelion test dye, in which it show purple color. No, but they can sometimes mainly cause their lungs, but they sometimes cause brain. They might transfer to the other part like brain, kidney, other parts, and may cause other diseases. Tuberculosis spread through the air when a person active, the person which has the tuberculosis disease, when he or she cough, the bacteria can transfer from one person to other, so it is a contagious disease. The symptoms are mainly chronic cough, night sweat, weight loss, blood with symptoms, and fevers. So in kids there is a vaccine called BCG vaccine in it is developed in 1906, which is used in childhood TB to protect kids from this. And for latent TB we have isoniazid drug as a management and treatment. And but active TB, in active TB we uses RIPS, rifamycin, isoniazid, pyrazinamide, ethambutol, and last one streptomycin. Mycobacterium is discovered by Robert Koch, and the test is to determine the TB present in body is a Montex test, which give result in 48 to 72, I mean 2 to 3 days. In this we inject PPD, purified protein derivative from the bacteria, from mycobacterium to the healthy person in forearm, and it will show swelling. Result will show swelling or any inflammation. So now we will talk about what is gram positive and gram negative bacteria. In gram positive bacteria, the main difference is it have a thick peptidoglycan, which help in the staining, and form staining के time dye staining, fast gram staining or gram fast staining. Gram fast staining, which will show purple color, and it also have a plasma membrane. But in gram negative, first we have from inner part we have a cyclopolysaccharide saccharide. Then we have a structure thin peptidoglycan, and plus plasma membrane. It's like this is the outer part, and the thin peptidoglycan helps when we dye a stain, it will show pink color because they are less in numbers. Symptoms are, we already talked about, chronic cough, flood in septum, low grade fever, night swelling, and weight loss. Depending on infection, disease may be caused as pulmonary, genitourinary, meningitis, and miliary. Now first we will talk first line drugs, classification of anti-tubercular agents. First line drugs, it is divided into first line drugs and second line. In first line drugs we have a RIPES, rifamycin, isoniazid, pyrazinamide, ethambutol, and streptomycin. For why we have first line and second line drug? First line drug means which have a high efficacy but low toxicity, but in some cases when the first line drug are not able to treat or manage the disease, so we develop the second line drug which have a low efficacy but have high toxicity. Second line drugs are used when the bacteria create resistance against the first line or when the first line is ineffective. Now we have a anti-tuberculosis agent based on synthetic and antibiotics. We have in synthetics E-pipe, this is a mnemonic, E-pipe, ethambutol, pyrazinamide, isoniazid, PS, para-amino-salicylic acid, and E for ethonamide. Then we have a antibiotic rifamycin, with the agent which are obtained from bacteria or any microorganism, rifabutin, cycloserine, streptomycin, and capiromycin. Isoniazid is also known as the isonicotinic acid hydrazide, which have a symbol of INH and H, hydrazide. The first line drug, it has a pyridine structure, pyridine. Then we have a CO and then NH2. Hydrazine, we have hydrazine like NNH with bond. It is a product. It can activated by peroxidase CatG, inhibit formation of cell wall. It is a bactericidal for growing bacteria and bacteriostatic. Bacteriostatic is a bactericidal effect, means killing, and static will stop the growth. It is a product and it's mainly inhibit the mycolic acid. From first main thing is mycobacterium has mycolic acid, in which this is the main thing we are gonna inhibit. Like for identification we can talk about that. So we are talking about isoniazid mechanism of action. Inhibit the synthesis of mycolic acid, which further decreases the synthesis of cell wall, and bacteria kills or inhibit. If the cell wall maintain the stress pressure between the outside and inside environment, and if the cell wall is break down or not able to synthesize, so it will cause the damage. Like this. First, this is the INH is a product. It get activated by catalase peroxidase CatG. Then it will bind with the enzyme called inoacyl carrier protein reductase, which will decrease the mycolic acid production, and the cell will be decreased and the cell will get killed. Then we have a synthesis methyl pyridine, in which we will add first main oxidation, then we will add hydrazine addition, then it's complete. Uses: tuberculosis, latent and active tuberculosis, treatment for complex mycobacterium avium. Ethonamide is also a second line drug. These are second line. We are talking about the synthetic classification based on the synthetic structures. So this is ethonamide is second line structure. It is also a product, means it need to be converted into active product, or else it will not show the effect. So it is activated by the monooxygenase. Mechanism of action is same. It will inhibit the mycolic acid inhibition, which will decrease the cell wall inhibition and kill the bacteria. Beta the bactericidal and bactericidal effect, and the effect is depend upon the concentration. If we give the less amount of the drug ethanamide, it will just cause the bacteriostatic effect. If we give the if we increase the concentration, it will kill the bacteria. This is a pyridine with ethane. See, this is ether. Thio means S. Thio means S. And amide is amide. Then we have a ethambutol. This is ethambutol. Make sure don't be confused between ethanoamide and ethambutol. Amide and ethambutol. Ethambutol is a first line drugs. It is a bacteria